People often ask me if they should go ahead and have spine surgery. Even though this is a question we've been answering for 20 years, each discussion is unique because each patient has a unique set of circumstances, so your answer will depend on your individual circumstance. However, when having this discussion, two criteria often at the top of the list are your age and what your MRI looks like. And these two things often put spine surgeons between a rock and a hard place. Here's why. As you age, your spine deteriorates. You start getting changes at multiple areas of your spine, things like disc bulges, degenerative disc disease, stenosis, and arthritis. And with these anatomical changes to your spine comes two important revelations. Number one, because the bones of your spine are linked together, it becomes less likely that all of your pain is coming from one little area of your spine. And number two, it becomes more likely that you have dormant areas of your spine. And what that means is you have areas of your spine that could cause you pain in the future, but for now are dormant or inactive. And that makes the spine surgeon's job a lot more difficult because surgery is supposed to zero in on the problem. And it's hard to zero in on the problem if there are too many potential causes. And operating on one area of concern could wake up dormant areas and cause you different problems or new pain down the road. When you're young, we expect to see fewer problems on your MRI because you haven't aged as much. But because you cannot undo spine surgery, the surgeon will often want to first pursue any and all conservative treatment, things like physical therapy, chiropractic, yoga, Pilates, and spine injections, and will tell you to wait it out and to only come back if you cannot take it any longer. Now, there are a few things that send you to surgery quickly. Things like cancer, infection, trauma, sudden loss of motor or muscle function, or sudden loss of bowel or bladder function. But the vast majority of time, patients do not need surgery and get by perfectly well with conservative treatment. I hope this information was helpful to you as you consider your treatment options. Charleston has a terrific group of spine surgeons, and we've worked with all of them over the years. But having spine surgery is still a big decision, and one in most cases you want to avoid facing, if at all possible.